The Honourable Leader of the New Democratic Party.
On June 25th, Black Monday for healthcare in Cape Breton, the government announced a unilateral decision to close those two hospitals without any public dialogue, with any meaningful local consultation, and on such short notice that a number of affected physicians had to get to the announcement in their scrubs. Yesterday, the Premier characterized the opposition to this decision as noise. Now, the Premier is responsible for the standards with which the work of the government is conducted. And so I want to ask him, in his view, has his government's conduct about the hospital closures in Cape Breton met his personal standard of according respect?
The Honourable Premier.
Thank you, Mr. Speaker, and I want to thank the honourable member for the question. What I was referring to yesterday, Mr. Speaker, was the noise that accompanied that event where I was, Mr. Speaker. As he would know, I'm sure, he would have seen the coverage of it. There was a number of people there who were not happy with the decision taken. I tell the honourable member that there was engagement with people in the island, healthcare providers, Mr. Speaker. I also want to tell the honourable member, we know when change is coming, it's difficult for communities, but I also want to reassure the honourable member that as we transition to the new healthcare centres in those communities that are providing the care for those communities, we'll be bolstering the regional hospital, Mr. Speaker, to make sure that we continue to build modern infrastructure that reflects the realities of today, at the same time ensuring that we're creating the environment that our healthcare providers want to work in.
The Honourable Leader of the New Democratic Party.
Just hang on half a second. So Dr. Craig Stone, staff anesthesiologist at the 4 CBRM hospitals, receives notice that the announcement is going to take place at 8:30 that morning. The same thing happens to plastic surgeon Dr. Abdul Attia. Dr. Margaret Fraser, president of the Medical Staff Association for the CBRM, says we are essentially blindsided. What I'm asking the Premier about are the standards that he establishes for imparting a sense of respect to communities and medical communities from his government. Is it actually the case that in the Premier's view, an acceptable level of respect has been accorded to the medical community and the rest of the community of the CBRM about these announced hospital closures?
The Honourable Premier.
Mr. Speaker, I want to thank the honourable member for the question, Mr. Speaker. I think it's important that we recognize, Mr. Speaker, the announcement was not received unanimously by all members of the community, Mr. Speaker. I think it's also important, though, that the honourable member stands in the House and tells Nova Scotians that there are members of the healthcare community and broader community, Mr. Speaker, who want to see a modern infrastructure brought. I want to quote the honourable member, Dr. Paul McDonald, head of internal medicine and Cape Breton cardiologist, on June 25th. This is a major improvement to help us take care of patients. I have a number of new specialists coming to our community who are going to practice critical care, pulmonary medicine, and if I bring them into a facility that is out of date, that doesn't have the equipment and the resources that they need, they're not going to stay. Quote, Mr. Speaker, I think this is a great day for Cape Breton, Mr. Speaker. Mr. Speaker, I also, Mr. Speaker, think it's important that Dr. Chris Melbourne, ER Chief, Mr. Speaker, said, I think this is an opportunity that we have in Collaborative Care Centre or a better family practice centre in New Waterford and Northside. I think people will actually get better care from the type of problems they have, Mr. Speaker. Mr. Speaker. So if we're going to cherry pick quotes, Mr. Speaker, let's be accurate, Mr. Speaker, and tell the real feeling of those communities.
The honourable member.